The European Union, EU, has pledged to support Africa's push to expand its vaccine manufacturing capacity. Towards this end, EU has promised €1 billion direct aid and funding to support 5 African countries, including Kenya, to manufacture COVID-19 vaccines. Europe also aims to donate at least 100 million doses to low and middle income countries by the end of 2021. Meanwhile, Kenya intends to mop up doses of vaccines that have not been used so far in the first phase to enable the country to start off the second dose vaccination by the end of next week.
As Africa struggles to acquire enough COVID-19 vaccines amidst global vaccine inequity, the European Union has thrown its weight behind the push to expand vaccine manufacturing in Africa. Ursula von der Leyen, the European Commission President, is expected to back proposals to establish strategic manufacturing hubs in African countries, a move welcomed by the Africa CDC as a step in the right direction.
At the level of the Africa Centers for Disease Control and Prevention and the African Union. If you recall, we hosted a very successful meeting on manufacturing vaccines on the continent on precisely April 12 and 13. And that meeting was attended by over 40,000 participants for 2 days. And we launched a partnership called Partnership for African Vaccine Manufacturing, which was announced by the chair of the African Union, President Felix Tshisekedi. So we are very pleased and encouraged to hear the Europeans rally behind this partnership.
There are at least 5 countries in the continent that have the capacity and capabilities to produce vaccines, both for COVID-19 and for other diseases. This includes Senegal at the Pasteur Institute, 2 factories in South Africa, Egypt, Tunisia, and Morocco.
We have those, and we have other countries that already are positioning themselves from a political will standpoint, like Rwanda. The president of Rwanda has come out very publicly to talk about messenger RNA, and they have their commitment, which is extremely important and valuable.
But EU officials insist the move does not address the manufacturing know-how and technology transfers needed by countries seeking to build vaccine manufacturing capacity.
On 3 goals. First, bringing this pandemic under control everywhere. Second, making sure that vaccines reach everybody everywhere. Team Europe aims at donating at least 100 million doses to low and middle income countries by the end of 2021.
Meanwhile, Kenya intends to mop up doses of vaccines countrywide that have not been used so far in the first phase. The cumulative available doses will enable the country to start off the second dose vaccination by the end of next week. So far, 951,026 people have been vaccinated. The vaccines Kenya is expecting from other countries have a shelf life of 1 month, which means they will expire at the end of June. For this reason, all frontline workers who got their first dose in the month of March should turn up for their second dose as soon as they're required to do so by notification from the Chanjo system. Health Cabinet Secretary Mutahi Kagwe, while addressing the annual Commonwealth Health Ministers, has called for the urgent redirecting of funds set aside to acquire 24 million doses of vaccines at the cost of $3.6 million from COVAX to other vaccine manufacturers with the capacity to supply the country with the vaccines, and specifically Johnson & Johnson would be the best alternative since it comes with the added advantage of being a single-dose regime and hence reducing logistical challenges. He further urged that COVAX and Gavi fast-track the redistribution of unused AstraZeneca doses to countries that are able to use them quickly to avoid expiry of vaccines while many people in the world need them. In the last 24 hours, 659 more people have tested positive for COVID-19 and 3 deaths have been recorded. Dorcas Wagira, Citizen TV, Nairobi.